So, with me here today to talk about the state of Canada's healthcare system is the renowned Dr. Brian Day. He was a pioneer in many areas. He developed the world's first surgical robot. He's also the past president of Canada's Medical Association, and he was the founder of the Cambie Clinic in Vancouver. So, a warm welcome to you, Dr. Brian Day.
Thank you, Dave.
So, how did you end up founding the Cambie Clinic? I know that certainly from people I know that have gone there, they have just been astounded by the quality of care, the degree of professionalism. How did you found this world-renowned clinic?
Well, just touching on what you just said, we are accredited by Accreditation Canada, which is the body that accredits teaching hospitals in Canada. And they have twice now consecutively granted us 4-year terms of what's called exemplary status, which is the highest of their 4 levels of accreditation, based on their objective reviews. And so the reason we started Cambi was that we started off as orthopedic surgeons and surgeons in general and anesthesiologists, where we would have in the 80s 25 hours a week each of operating time to treat patients. So there were no wait lists, and patients were getting treated when they needed to. If someone had an injury, they were treated right away. If someone had arthritis, they'd be treated within weeks and not years. But then as the rationing extended, and in many ways, medicine became a victim of its own success. That technologies improved, we were able to do more, and government had this fixed budget. So the way they managed it was to cut back on patients being treated. And that extended not just to cutting back hospital operating rooms, but cutting back on staff. But the point is, overall, is that we did not have a place to treat our patients. By the time we opened Cambi, I had been whittled down and my colleagues, to 5 hours of operating time a week, and I had over 400 patients waiting for surgery.
Sorry, 5 hours a week, and meanwhile you had how many people on a waiting list?
Over 400 patients waiting to get into hospital for me personally. And so this was the rationing process. And this relates to another issue with Canada's funding for hospitals, is that our hospitals in Canada are unique within the OECD in being fully funded by block funding, global budgets. So a hospital like Vancouver Coastal Hospital, for instance, the last time I checked, they were receiving $3.8 billion a year to operate. And it didn't matter how many patients they treated, that was it. So every patient that visits the hospital, whether it's an emergency department visit or an operation, is using up the establishment's money. So it's not patient friendly. In every other developed country, money follows the patient. And that means hospitals in Europe, in New Zealand, in Australia, they want patients. These are countries with universal systems. If you go for a hip or knee replacement in, say, New Zealand, the government health system, in the public system, pays the hospital a fee, and it might be $10,000-$15,000. Therefore, the chief financial officer in a public hospital in England or New Zealand or Denmark or Holland or Sweden wants patients. In Canada, the last thing the chief financial officer wants are patients, because they use up their annual budget.
Okay, so you've just laid out in Technicolor for us right there a seminal point, Brian, or Dr. Day, in the sense that the hospitals get a big block of funding, say it's $100 million, which seems like a lot of money. But as soon as they get that money, they don't have an incentive to really serve you as a patient. As much as people care and do want to be helpful, they see you as a cost. There's no incentive to serve more of you if anything, the incentive is to serve fewer patients. Is that right? So they can preserve their
That's
budget.
exactly.
Am I simplifying it too much?
No, that's exactly right. So I recall one time I approached a public hospital administrator with a request to get this latest and greatest new equipment.
Hmm.
In my naivety, I said, we'll be the only hospital in Western Canada that has this equipment. It's going to set us apart. It's less invasive. It's better for the patients.
Hmm.
That
Hmm.
Oh, no, said the administration. The last thing we want are more patients coming to the hospital. We don't want that equipment. And that is
Isn't that funny? Yeah.
yeah.
So this is what I think a lot of Canadians, like we've been taught that our system is so great, but the facts don't show that because the design of the system is kind of like Soviet medicine. Is that right?
Well, except that the Soviets don't outlaw a
Oh
choice.
yeah. Yeah. Right.
So, I
Wow.
mean, what was interesting in our legal action was that a witness for the government, a Harvard professor in health, expert on health,
Hmm.
Professor Shao, he gave evidence, which the government didn't like, that Canada was the only country on the planet out of the almost 200 countries or so that there are, where it was unlawful to obtain private health insurance or private health care. It was the government lawyers tried to quieten that down, but that's the reality. We are the only country on the planet with a state monopoly that's enforced by law.
So this is quite a revelation. So that's part of the context that we're in, and you have been, to your credit, you've been the past president of the Canadian Medical Association. You have been a pioneer in so many areas of not only your specialty, but being a pioneer in calling out the need to change and reform our healthcare system to better serve patients. And so my question is, if you look at the basics, though, if you think about the state of Canadian healthcare, what are the overriding facts that show that this is not a high functioning system?
Well, there's a group called the Commonwealth Fund that looks at um, its mandate is to look at ways to improve access to healthcare for low income groups. And Canada, of 10 countries with universal healthcare, has the worst access and health outcomes in lower income groups. So it's not what politicians profess to be a good thing about our system is the opposite. We're the last. And part of the problem in our system, and this is pervasive in other areas besides healthcare, is we have a massive expense based on public uh, administrative costs. So we have 11 times as many public administrators in our public system that Germany has in
Okay.
theirs. And in Germany's public health system, you don't have patients languishing for years on wait lists.
Okay. So we have a large bureaucracy. It's a basically centered on a public monopoly. I mean, not entirely. There's aspects of our healthcare system that does allow for, say, private chiropractors and naturopaths and a variety of those people. But the core of the system is this expensive bureaucratic system with large waiting lists. So, are there people dying on these waiting lists, Brian? Have you seen that?
Oh yes, yeah. I think that it's tens of thousands, maybe 30 to 40, or even double that. We don't know because our statistics mostly come from government, and we know based on our efforts at our constitutional challenge, governments hide this data from the people. They know full well how many people are suffering and dying on wait lists. They try to hide it, and so various groups have to um, go to, including yours, I believe, have to go to forcing this information out of governments. And we had to, at trial, we had to call hostile government witnesses to get the data that the government said that the government lawyers would not admit they had. and we know that. I mean, years ago, I remember the Attorney General of sorry, the not the Attorney General, the Auditor General of Ontario, came out with a statement that children are dying on wait lists as a result of the health system's operations. Public governments across the country are hiding this data from the public, and
Well,
they need to deliver it because it's the public's information.
well, it's a disturbing revelation that that data should not be transparent. I mean, that's a very important principle, and good public policy is to be transparent with information,
Yes.
because if we are not transparent, we can't compare data on what's performing and what isn't. So, shame on our system for being so opaque or like a black box. And I think that this is where we've been sold kind of a bill of goods here in our country, where somehow, I mean, we all know the conversations with fellow Canadians, and we all mean well, where we say, well, thankfully we have this quote free medical healthcare system. Well, it's not free; taxpayers pay for it, and it's certainly among the most expensive in the world. But
Yeah.
we don't even know whether it's really performing that well beyond certain measurements where we know that a lot of people are on waiting lists. And I think this is the paradox, is it not, Dr. Day, that just because that healthcare system exists and you could go on a waiting list, what's the point of that if it's not accessible and you die on that waiting list?
Well, that Supreme Court of Canada in a Charlie's came out and said that access to a waiting list is not access to care, and of course we know that you'll hear governments, our BC government, NDP government, lamenting the shortage of doctors and nurses right now. What they don't publicize is the fact that it was an NDP government in the 90s that decided and made the diagnosis that the cause of rising health costs was doctors and nurses treating too many patients, and they formed a commission, and they implemented the recommendations of the commission, and actually provinces across the country bought into it, closing medical schools by up to 30%. So, and closing nursing schools. We used to have big nursing schools at the local hospitals. They were all closed. So here we have now the same a subsequent NDP government lamenting the shortage of healthcare workers. They're the ones that cut them back, and
Mhm.
it's very irritating to hear them, when the cause of the problem was the government. And
Okay, so
when I came to Canada, we were second in the world in doctors per population, in the numbers per capita. Today, according to the Index Monday, we're 69th in doctors
sorry,
per population.
69. So this is why so many people don't have a general practitioner. They don't
Yeah.
have a physician.
And in Canada, as you know, if you don't have a general practitioner, you don't get to see a specialist either. So it's a double whammy.
Okay.
And that part of the block is if you can't get to your family doctor, you can't get to a specialist either.
Okay, so we want to obviously point to evidence, and this is certainly not a partisan discussion, but this is what happens when you institute kind of a socialist public monopoly on healthcare, is you get bad results, and this has been proven the worldwide. But in Canada, is it an overstatement to say that our healthcare system is in crisis?
Oh, absolutely. It's in a crisis. I think something has to change. I think the public is beginning to recognize it. The polls show that, and hopefully, governments will come in with a promise
Hmm.
to fix this. And as I like to say, we just watched the Olympics. If if you're coming in 10th or 12th in an Olympic competition, your country's coming in 10th or 12th, and you want to improve, shouldn't you look at the way the top one or two countries are training and running their programs? And that's what we should be doing. We should be looking at
Yeah.
Norway and Denmark and Sweden and
Mhm.
Germany and so on, and learning from countries, Holland, learning from countries that outperform us in every way and spend less on healthcare than we do, and yet no government so far in Canada has had the courage to do that.
So within your system, we know that we can learn a lot from other countries. So that sounds to me like a kind of a breakthrough kind of commitment that you'd think any politician would get on board with.
Without open discussion and debate, you're not thinking, nor are you free. Comment below. We'd love for you to join the conversation.